All right. Hello, everyone. Thank you all for joining us. My name is Ren Healy, and I am a sophomore senator on student government. During this Q&A session, I'll be relaying your submitted questions to a panel of our representatives from the COVID response team. Our panelists tonight include President Quillen, Dean McCrae, Chris Clunie, who's our athletics director, and also Robert Lutz, who's the medical advisor for our COVID response team. Also with me tonight is Israel Palencia, who's SGA's sophomore class president and also my co-moderator. So before we begin, I'll just briefly touch on the structure of our event. We had over 100 questions submitted through our survey. So unfortunately, we will not get to everything tonight. But among the questions submitted, there were a few themes that just came up over and over again. So we're focusing on those during the Q&A. Insofar as it's possible, we've just taken our questions verbatim from what you all submitted, at times altering them for brevity or combining them to just cover more ground. So we have a lot on the agenda, and because of the quantity of those pre-submitted questions, we won't be using a live chat feed tonight. So our aim is to narrow in on the content at hand here. Naturally, this event cannot come close to fixing every problem or alleviating every fear about COVID. It should, however, allow for the direct representation of and some direct discussion about those issues that are most on your minds, the students' minds. So to just start off this conversation, I'll present a number of the questions that didn't really fit cleanly into the broader categories of concern that we identified in the survey submissions. And then after I'm through with this first brief set, Israel and I will just alternate as moderators, switching topics during each of our turns. Okay, I will begin with our first question then. That question is, what is being done differently this semester following the large outbreak on campus?
So maybe I can just start and then defer to Dr. Lutz and others for their expertise here. First, I just want to say huge thanks to Ren and Israel for moderating for us tonight, and thanks to all of you who I can't see who are joining us for this webinar. I am really grateful for the ways in which you are, as our students, are dealing with COVID. It is not an easy situation. Generally speaking, everyone is doing everything they can to help us get through this. And I'm really grateful to be at a place where that is true. That is not true in every context. And so thank you very much for everything that you're doing. It's a privilege to be on a campus with you all. So in terms of what we're doing different this semester than last semester, I'm going to take a step back from the question, which speaks to a specific outbreak, by which I think what's meant in that question is a large number of cases, of positive cases on one day, right, is what I think outbreak is meaning there. So let me just take a step back and talk about how we prepared for this semester based on last semester. Lots of things came into that: the prevalence of COVID around the country, the higher positivity rate, the fact that students were going to be traveling back to campus. And so we planned a more aggressive testing protocol. We narrowed the window in which students were asked to take the pre-arrival test. And we tried through that strategy and we restricted guests. And we tried through that strategy to identify and quarantine or isolate folks who had been exposed to COVID and didn't know it and brought that onto campus. So that was based on the context in which we were operating in North Carolina and around the country. With respect to how we respond when there's a day at which there are higher outbreaks, I'll defer to Dean McCrae and Dr. Lutz in a second, but I would say that we try to figure out why there is a large number of cases on one day. It may indicate an outbreak, it may not. COVID is very prevalent in the environment, so we try to understand through contact tracing why that occurred through Dr. Lutz's medical team. And if we think there's a single event that led to that large number of positive cases on one day, we act in one way. If we think it's just a lot of individual isolated events, then we might do something different. But always the protocol is to isolate students who test positive and make sure they have the care they need, and quarantine people who've been in close contact with them to prevent the further spread. I'll stop talking and then defer to.
Sure, so I'll jump in here with a couple of comments. So I mean, one of the first things to think about is that we came back to school during a period in time where, the nation was coming off 2 successive holidays and a dramatically increased prevalence of the disease across the country. So, great time to start school. And so we put all these measures in place with the pre-arrival testing, testing on arrival, testing as soon after arrival as possible, and then testing twice a week after that, knowing that this was going to be a big challenge. So a couple of things we're doing a little differently than we were able to do last semester. And, of course, we got the 2 times a week testing for a lot of students as we started. I also worked it out with our test vendor such that we get a much more rapid return of the tests. So pretty much at midnight tonight, I'm going to get a call, and I'm going to know what we're doing tomorrow. And so if you think about that, and if you've ever tried to get tested out in the community, getting less than 24 hours, and in our case, sometimes 20 to actually less than 12 hours, because they leave at 3, and I get a phone call at midnight, is pretty awesome. And that speed and rapidity of the ability to respond is key in controlling this disease. So we're doing that a little bit differently. Another thing, if you've ever been put into quarantine out there, you know that we were testing you before we put you into quarantine. We weren't really able to do that in the fall. We would just put people in quarantine and sort of wait and see what happened. But the use of tests as we put people into quarantine allows us to expand that circle of contact tracing. So if the positive person had somebody that was a close contact that we were putting into quarantine, and we tested them and they tested positive, then we expand the ring out and expand the ring out. We didn't have that capability before, and so that's one of those things that actually generated on what was probably our largest day, I think January 25th or 26th, because we just had, I want to say 11 positive tests through our Mako testing, but we also found 5 other people through that expanding ring of testing people before they went into quarantine. So I think that has been really helpful in trying to shut down the spread. What's really interesting this semester as compared to last semester is that the disease seems to be spreading better inside than it did before. And I think it is because of the winter, and that people are inside more and they're closer together more versus August, September, October. We noted a real change in November. A lot of you remember there was sort of a little explosion before we all left. The weather got bad. We started to see positive tests that were chain linked together between exposures that we hadn't seen before. And I really attribute that to cold weather, being inside and staying closer together. And so we've seen that now as we came back, the same sort of thing where going through groups of people that through their contacts were close together in ways that the disease spread. And in fact, a pretty interesting statistic, I was looking at it earlier today, that we only had about 5 to 7 people who became positive while in quarantine last semester. So that's out of about 53 or 54 positive tests. So about 10% maybe. This semester alone, we've had 39 turn positive while in quarantine, which is a little bit over a third of the cases that we've had. So if you think about it, and it's reflected right now in the fact that we've got 38 currently testing positive, and 10 of those are people who turned positive while in quarantine. So they didn't get a chance to expose any of you guys out on campus. And this is, to me, this is a huge win, and it shows that our procedures and policies are working because we're able to kind of nip this thing If they weren't, those 10 people would be out there potentially spreading the disease and expanding things. So I'm comforted by what's going on as I kind of dig into the numbers and see what's happening. And I know on the other side of the dashboard, there's people seeing, oh my gosh, these rising cases. But if you think about it, it essentially 1 out of every 3 cases that pops up there is somebody who has been off campus now for 3, 4, 5, 6, 7, 8 days and not a risk to anybody else. The final thing I'll mention that we've done differently this semester is that the CDC guidelines are good. Okay, they're guidelines and that's what we follow. But viruses don't behave and follow rules that people write. And so one of the tools that I've used in the toolkit has been a thing that I call enhanced precautions. So somebody maybe doesn't meet quarantine criteria. Okay, I mean, they don't meet quarantine criteria, they don't meet quarantine criteria, and I don't feel like we should put them off somewhere. But if there's a reason that say, hey, you know what, maybe there's a little increased risk here. Well, here's what we can do. We can ask you to take to-go meals only, to really be diligent about your masking and your distancing, and not to go to class. And for those folks that we've done that was an additional 14 people that subsequently tested positive. So you start running the numbers, almost 50, 54, 55 of our 120 or so cases this semester are folks that were essentially moved out of the population and at little risk to others. And I hope, that's something that's not necessarily seen when you look at the dashboard or you think about things. But if you realize that behind the scenes, we are working to limit the spread in ways that may not be apparent at the time as you look at the numbers, but they're there and I think they're working. And we had a pretty good week last week and we're, knocking on wood, so far we're having a pretty decent week this week. So I'll pause there, but there are a whole bunch of things we're doing different, and I think it's being effective.
Great, thank you, Dr. Lutz and President Quillen. As we continue talking about reducing the spread of this pathogen, there is one question that often comes up, or at least enters students' consciousness, and that is what is going to happen with regard to the graduation ceremony.
So we have a committee that's working on that in collaboration with students and coming up with what might be possible for graduation. So I can't tell you exactly what's going to happen at this point, but I can tell you that there's a group of staff working in collaboration with some seniors to try to figure out what is possible and what we can do that meets most of what students want. And a lot of it we won't know until very close to the time, as you guys know. But that is in progress, and there's a group of people figuring that out. I can't tell you what the answer is at this point. I don't think we know yet.
Great. And we have one more question in this sort of miscellaneous section. It's a bit of $1 million question. Are there any estimates that we have on when students will be able to receive the vaccine?
I don't think we have reliable estimates on that at this point. I think we meet with the state every week or every other week and get updates on what's happening there. So as soon as we know any more information about it, we'll definitely share it with you. We have asked basic questions like, will all of our students be eligible? You don't have to live in North Carolina, for example, to get this vaccine. Yes. So once it becomes available, we will have eligibility for all of our students, but when, I can't tell you that. I wish I could. I can't tell you, but as soon as we know, we'll tell you.
Great. Now I'm going to pass things over to Israel, who will get us started on student concerns surrounding athletics.
All right. Hello, everyone. Good evening. Now we're going to be shifting towards the topic of athletics, as Ren said. So we know athletics has been a significant concern for students over the past couple of weeks. So in approaching this topic, we sought to represent student voices as authentically as possible. The questions we've included are largely verbatim from the submission form, at times adjusted for brevity. Here's our first one. How did the school decide to bring back athletics this term? Drawing from outside examples, other institutions with highly competitive athletics have canceled their sports due to new variants on campus and others due to COVID spikes.
Yeah, thanks, Israel, and thanks for the opportunity to be a part of the panel. So similar to kind of what Dr. Lutz and Carol mentioned, we sort of took what we learned in the fall and tried to apply it to put a really robust plan in place for this second semester. We only had 2 teams competing competitively, men's and women's basketball in the fall, and that was after actually everybody went back home for the semester. So with fall sports being moved to the spring, we first looked at sort of when seasons were slated to start and then sort of worked backwards from there. So we had teams sort of come in waves. I think it was 3 waves. You had a few teams that were here over the winter break, and then kind of in succession, 3 different groups of teams or groups of scholar athletes that came back based on when their semester started. You look at sort of what other institutions have done. First off, what I'd say is we've committed to athletics because we believe in the educational value of athletics, just like we've committed to sort of being back in a residential community, right? Like we see value in it, but we're also not going to do it unless we can do it in as safe and healthy a manner as possible. Absolutely knowing and understanding that there are risks and that athletics is truly an exception to the rules that are sort of being put in place. And so with that comes a greater accountability and responsibility, especially for our scholar athletes, in terms of following COVID protocols and making sure that they understand that by competing, they are, again, receiving special privileges and sort of going against our normal protocols. And then that accountability to the greater community and to the rest of campus is that much greater and that much more of a sacrifice. I'd also say, again, you have to remember scholar athletes are students first, right? So it's also the fact that the high majority of our scholar athletes are doing the right thing, right? Have done the right thing. And as we've seen is what Dr. Lutz has said, there's higher positivity, there's higher community spread. There've been a number of our scholar athletes that have gotten it, and they've tried their best not to get it. Now, there've been a number of scholar athletes who have engaged in reckless behavior and unmasked behavior, and we found that, again, that's a small number one, and number 2, we know that transmission of the virus is really, as Dr. Lutz said, through indoor unmasked activity, right? And so that's been scholar athletes, that's been students alike. We have not found a ton of evidence that shows that, save for a couple high risk sports, that it's transmitted through athletic activity. And so that's sort of what we're seeing, especially when we do our contract tracing. And even when we had the quote unquote outbreak, we were able to trace it back to a non-athletic event. And again, more of a sort of off-campus social event, right? So I think I talked to the SGA last week and really laid out sort of the enhanced protocols and guidelines that we follow across the NCAA in line with the CDC. And Dr. Lutz can attest to sort of the guidelines that we have to follow are actually stricter in terms of what we're trying to implement. So it definitely is a good question. We continue to follow our protocols and try to do sort of the best that we can from an accountability perspective and to limit the risk. We know there's risk, but I think our scholar athletes and our teams are committed to limiting risk as much as possible, knowing that we have a responsibility to the rest of campus.
Thank you for that. And kind of going off of that, what specifically has the athletic department and its athletes done to accommodate for this issue of the spread of the disease?
So our teams train completely different than how they had normally done sort of non-COVID, right? So if you think about sort of our teams are breaking up, there's more staggered practice times. I mentioned in the SJ meeting, our football team actually practices with masks. You can't see it, but they're underneath the helmets, right? They don't even practice as a full team sometimes. A lot of times it's by class or offense, defense, and then a different subgroup. If you look at other sports, they practice kind of at different times. They practice in staggered pods. A lot of our teams aren't even using the locker rooms, or they're going in waves. They're breaking it up. They're dropping off their laundry at different times. So we've sort of worked with Dr. Lutz and the rest of our medical team to sort of put together protocols that limit contact as much as possible, that try to keep people outdoors as much as possible, and try to make it such that, you know, even down to the seating assignments on the bus, we know who's sitting where, how far apart, such that if something happens, we can sort of pretty easily move into contact tracing. Similar to the rest of the campus, our cleaning protocols have been greatly enhanced. If you look at what our maintenance staff does across athletics, you guys haven't been able to see because you haven't been at a basketball game, but I mean, at halftime, maintenance staff are spraying every single bench, every single basket, every single ball down to the tee. So we sort of look at the entire spectrum of everything that athletics does, the potential contact, and we're trying to mitigate all of those risks. The training room, you have to sign up and go at specific hours. You can't just go in whenever you want. There's a limited amount of people that are allowed down there. Everything has sort of been structured such that, understanding the risks that we do have, we're trying to mitigate that as much as possible through enhanced protocols. So there are just a number of things that we do, from the way that we train, the way that we schedule. We cut the number of competitions this year. A number of our Olympic sports reduced their competitions by 25%. If you're playing a non-conference, meaning non-A10 or non-SoCon PFL, we didn't fly. You could only bus, right? So there are a bunch of different things that we put in place to sort of do our part to try to mitigate the risk of exposure.
Okay, thank you for that. So following along, there are students who feel like these COVID policies, while minimizing contact, still negate the hard work the rest of the community has put into preventing the spread of COVID. So how can we continue to reinforce our faith in the athletics and have more transparency from the athletic department moving forward?
Yeah, it's a good question. Again, I mentioned in kind of the first question, we absolutely understand that athletics is an exception, right? Like, we have all of our protocols, and yet athletics is engaging in competition. And what we kind of fall back on, and again, the data backs this up, is we have not seen great transmission through athletic activities, right? So it continues to be through unmasked indoor interactions. And the majority of our scholar athletes are trying to do the right thing, and we have had a small number that have not done the right thing. And what we sort of said was, we can deal with and sort of understand if our teams get exposed to COVID, right? So for example, our women's basketball team played in a game, player test positive the day after, exposed the whole team, they go into quarantine. That wasn't our fault, right? And actually nobody on the women's team, knock on wood, tested positive, right? They did everything right, and we still had the risk of being shut down, right? Like, we can live with that. And that's part of the destigmatization of COVID, is we don't want people to be afraid of getting it. We just don't want folks to willingly or recklessly put themselves in positions to get it. The community spread, the high positivity rate, we know you could try to do everything right, still won't matter. It is what it is. We can live with those. What we can't live with are where people sort of justify or rationalize behavior that goes against our rules, that allows people to go into that allows people to go into violating the guest policy or whatever it is. Like, we can't sort of shoot ourselves in the foot. Byron, that was a good point. I want to clarify that a person from the other team tested positive in the game, not us. And so I think just by understanding sort of the responsibility that we have, and also understanding that if we simplify things and follow the rules, especially in athletics, because of the protocols we've put in place, we feel pretty strongly that we will continue to limit the spread. And I look to a number of our teams that have done incredibly well. Again, I knock on wood. There's some of our teams that have not had a positive case all year. Again, knock on wood, right? And there's some that have just a few, right? Here or there. And so we really have the ability to do this in a safe and healthy manner as possible, limiting risk as much as possible. But again, being accountable to our campus community. We keep talking about our shared responsibility, and that is the most critically important thing in order to help us sort of be able to stabilize and do this right and move forward as a campus.
Can I just add? I mean, just we tried. I don't know if this is going to make sense to people, but we tried even in the fall to say to make it possible for things that cannot be done remotely, online, or that literally cannot be done. Another example is lab research. How can we continue to enable our faculty to do their research, students to work in labs, chorale to sing, theater to do performances. How can we, these things that are not possible to do in any other way, is it possible that we can do these things safely? And so chorale has special masks that they wear when they practice. Jazz ensemble practiced outside. Theater did a performance that with socially distanced audiences in cars. And so I think we're trying to see what can be done safely. There isn't a lot of evidence that athletic competition is causing widespread community spread on our campus. Obviously, if that were happening, we wouldn't be playing, but it's not happening. So I think it's important to recognize that it is true that in these high contact sports, women's basketball is a good example. If somebody on the other team or on our team tests positive, the entire team goes into quarantine, but that's to protect everyone else.
Yeah, thanks, Carol. I'd also say, I mean, as Dr. Lutz said, what the protocols and everything we have in place, we try to be even more conservative and strict. So a perfect example is, our teams are broken down into high, medium, low contact risk sports, right? And so the low contact risk sports are what you'd imagine: tennis, golf, swimming. Medium risk sports are baseball, lacrosse, soccer, etc. And then you've got kind of basketball, football, wrestling. Volleyball is considered a high risk sport, but if you play with a mask, you can sort of move it down to a intermediate risk sport, right? A lot of programs have chosen not to play with masks, and we said we want to play with masks. Like if there are ways to mitigate risk, like we are doing the absolute most. We're testing more than the NCAA tells us to test. So we've kind of taken that stance that here's sort of the baseline, and we've gone beyond the baseline and also required more of the baseline from the opponents that we're playing. So I think, again, sort of taking a more hardline strategy that if we're going to do this, we're going to try to do the absolute most that we can. Again, understanding our ultimate obligation is to the rest of the campus community.
Thank you, Mr. Clunie and President Quillen, for your responses. They've been very insightful. And now I'm going to be handing it off to Ren, who's going to be talking about policies.
Great. Thank you all. Thank you, Israel. Yeah, we'll now talk about some of Davidson's COVID policies. COVID policy is definitely the most common topic appearing in students' responses, which just goes to indicate how much of a concern it is and the great degree of impact that specific policies have in students' daily lives. So we actually received about 50 questions just regarding the guest policy and bringing back close contacts. So this following combination of questions appeared many times over. It's, am I expected to only see my friends in commons, in union, or outside? And then why are unoccupied lounges still off limits? And wouldn't opening the lounges discourage gatherings in dorm rooms?
So I'm gonna jump in, and so as we look at these policies, and I know they have a big impact on the students, but on the flip side, if we didn't have them, there's a potential larger impact there. And so this is a constant sort of push-pull, and it's something that we evaluate really every week as to like, when can we maybe take a step back? But I think what we learned in the fall was we did great, right, for a while, but I don't think we were tested, and we took some steps back. And then when we took some steps back in mid-November, we took out all the fire breaks and all the fire doors, and we had a blaze erupt. And it was very challenging to get control of there towards the end of the semester. So this is, I think, the hardest thing about this disease is the ability for it to spread amongst our friends, amongst people we think that are safe. And gathering together, which is what we all do and love to do with our friends, is the riskiest thing that we can do. So how do we do it safely? And this is where I think trying to be as creative as possible, figuring out what can you do outside, trying to get the tents set up, the outdoor workout facility, allowing intramurals to get started and doing those kinds of things. So in my book, anything we can do outside is awesome, to see your friends, to socialize. And I know the weather is not supportive of that at this point, but it will get there. And the more we can do that, the safer we'll be over the long run. You know, certainly our goal is, as things improve, as we kind of watch the case counts and see what happens, we're going to get to a point, I think, where we'll be able to step back from this somewhat. But we have to do it with the understanding that, just like we did in November, when we had a blaze erupt, we might have to switch it back on. Because every time you take out one of those fire breaks, it's good until it's not. And when you get an inject into the system that then can run free, if you don't have some of those walls in place, it can lead to a few bad days in a row until you get things under control. So, I mean, we hear you. We hear it all the time, and we know that's what you want. Determining when the best time to do that, as we watch the cases fall, is a challenge that the group has accepted, and we'll do it with the understanding that every time you take down a wall, there's a chance we might have to put it back up in a fairly short order.
Yeah, so Dr. Lutz is using a metaphor. I mean, we mean safeguards, we mean these policies, we mean these kind of unfortunate restrictions that we have. And so when we relax them, it can lead to the spread. And so we want to make sure that we are being really rigorous in our hand hygiene, our mask wearing, et cetera. And if we're able to do that, we might be able to have guests back. We might be able to test less frequently, or maybe we keep testing twice a week while we're having guests in rooms eventually, if the numbers drop. Is that a good synthesis, Dr. Lutz?
Yeah, and I think like bigger spaces with a mask on. So we're trying to figure out, okay, where are there big spaces where, you know, students can gather in some, you know, with a small number of people, keeping a mask on. Our challenge is that in some of these spaces, it's not just we gather and then we relax and we're with our friends who are tested all the time and we take our masks off. And so I think, and I know you are totally sick of hearing us say this. Like, I get that. I'm sick of it too. We're all sick of it, but it alas is the reality of this virus. So we're trying to figure out, okay, where are good places to go to meet up with friends? What are good things we can do outside if the weather would cooperate? How do we have much more to do, intramurals, you know, what else can be done outside to make it seem like there's many more activities. I'm grateful to the union board and SGA for setting up things for students to do, these meetups, and the builda was amazing. So I was over there and it seemed like that was fun for people. So we're continuing to look. And if you have ideas about things that we should do or that union board should do, I really encourage you to share those, because if we can do it, we will definitely try. And I know union board and SGA are, you know, working hard on that too.
Great, thank you all. The second main sub-theme within this policy category pertains to punishment. We have one student who asks if you can all provide some specifics on what the punishment system looks like for students who break our COVID policies.
Yeah, so I think we're really asking you to do something challenging here, is like get in a Dr. Strange mindset. And I don't mean to be so like, get into your most zen, like I can control me, right? I can wear a mask. I can, and I know that students are frustrated by their peers who don't do that. But if we're concerned about getting sick ourselves, we have a lot of agency in terms of not getting sick. And I also get that it feels really unfair for students who are being flagrantly disrespectful. There are certain activities, like a student might be seen not wearing a mask on a picnic blanket by themselves in front of chambers, right? And so that might be reported to us, and that student might get a warning. Or we might not realize that, like Byron McCrae has been seen 5 times without a mask, and his hall counselors talked to him. And so the student body might know that Byron's a jerk, but Sarah Buchanan, the Associate Dean of Students, might only have 1 report. And so I think what we're seeing is students are seeing or perceiving really disparate kind of numbers of warnings, and it's looking unfair. And so I think we're trying to wrestle with that and trying to give the hall counselors and the RAs some guidance. I've said before, it's not realistic for them to be the quote unquote COVID police. It's really not a lot. It's not fair for them to bear that. And we are committed to maintaining a safe environment. So to answer your question, Ren, really directly, we don't operate on a strike system per se, but if a student has been told, like, dear Byron, Israel saw you without a mask on in your hall, this is your warning. If Byron should know, because every message from the correspondence team tells Byron to wear a mask, right? His dean tells him to wear a mask in every email communication. The health advisors have done a video. And so by the time Byron gets a formal warning, at that point, if he violates the policies again, he's more likely than not going to go home. There are some students that might have a guest policy violation and a mask violation, and that's where it becomes really burdensome for the staff to actually, and I don't mean that in a, we don't want to do it way, but we're trying to engage students realistically in, are you not understanding the policies? Do you not believe in them? And so those conversations are really time intensive. I hope I've answered the spirit of your question. We're not doing like a 1, 2, 3 strikes. We were really clear in Q&As and email communication that if you're not going to follow the rules, you can't stay here. And so that's why some students are kind of shocked or disappointed on both sides. Some want us to be more restrictive and more enforcement based, and others want us to be more restorative. And so we're really trying to strike a balance while trying to keep the campus safe.
Great, thank you very much. Yeah, this theme of strike policies has come up repeatedly, and it seems like there's no real strike count that will entail a student getting sent home. It's much more circumstantial, much more oriented toward a case-by-case basis system.
But Ren, I would add, and having again dealt with scholar athletes that have gotten warnings, like Byron's team is pretty clear, right? It's like if you get a formal warning, it says in there that the next one you could get kicked off. It's pretty clear, and that's what I try to help. I had a meeting with our team captains last week or the week before, I can't remember, and it's like just control what you can control. Byron talks about agency. It's like it's pretty clearly laid out, and I know that we're part of it is circumstantial, but it's just like if we follow the rules, then we sort of get to where we want to, right? That's the biggest piece of this, right? And it's pretty clear, and it's not necessarily equitable, but it's pretty fair, right? And it's clearly stated. So that's the biggest thing is we lay it out and we try to do the best we can, but that we have to sort of maintain some accountability for our own actions.
Great, thank you both. We also have a question in this category that addresses a really common student desire for a sort of timeline, laying out exactly when socializing and extracurricular activity will once again be permitted. Is there any talk of when students will be allowed to have guests back over, I guess, like a more formal date, even a limited number of guests, or are there any specific dates or sort of case number thresholds by which point we'll know that we'll be able to engage in some more traditional college activities once again?
So from my perspective as the advisor, as things start to stabilize and case counts start to come down, that's what I'm looking for, is that we have some sustained dropping of our case counts that say we've now got the freedom to relax things a little bit. And can you put a date on that? It's out there, it's somewhere. I wish I could give you the exact day and time, but it's really circumstances based. And I don't want to insult your intelligence by saying, hey, on March 1st, everything's going to go back and you can have guests and you can do this and you can do that, because I don't know that that's true. I hope that it's true. And I hope that as we move forward, we're able to do that. But as we look at our, other colleges around the state, places, Wake Forest is having a big blow up, and some other places have essentially had very similar starts to the school year as we have. And so guarantee you, we're talking about it every single week and almost every meeting that we have as a core team as to when can we do this. So we hear you, and we'll do it as soon as we can, but I think it would be unfair to try and give you a date.
Great. Thank you. And now I'm going to hand off the reins to Israel once again for our very last topic, which is mental health.
Thank you, Ren. As you said, this is going to be our last topic, mental health. And the first question, due to the growing intensity of academics and the lack of safe social outlets, the mental well-being of students has been severely impacted. What are tangible ways that the administration is working to address this issue? Are there plans to provide more safe outlets for socialization? And is the administration working with faculty to address the difficulty of being a student during COVID-19?
Sure, I think I can get started on that. I mean, I think some of the academic policies that have been enacted by the faculty have been a gesture at exactly this. And so I'd want students to know that when they write to me, when they write to President Quillen, when they write to the chaplain and express concerns, we're pretty transparent in sharing those that outreach with our faculty colleagues. So both President Quillen and I are on the faculty executive committee, which does a lot with faculty policy, and the speaker pro tem of the faculty, basically the chair of the faculty senate, is very much an advocate for students' mental health needs. And so that's why we've been able to make some adjustments to academic policies, like being able to take 3 courses instead of 4 to be considered full-time, or adjusting graduation requirements. I think the broader topic, I've been asked a lot of really specific questions. I'd want you to know that we've stood up several counseling groups. And so if students follow the counseling center, I think it's literally Davidson Counseling Center or Davidson College Counseling, you'll see a number of groups that have been created to meet student needs. And the counseling center also does basically pop-up or kind of just-in-time sessions, or like open forums or drop-in sessions for students. We've been able to hire 3 licensed counselors, and so they're doctoral students who are licensed to practice in North Carolina, and another full-time psychologist who has years of experience at UNC Charlotte. So we're bolstering counseling supports. We've also I heard through Georgia Ringel that a lot of students are on the app Calm. And so we actually called Calm and like, yo, give us a site license. Like let all of our students have access to Calm for free. And they wouldn't give it to us. And so instead we're looking at some other partnerships. And so we have a partnership with a platform named Caravan. If students get onto Wildcat Sync, you'll see a story about Caravan. They have guided meditations, and so does SweatNet, which I wouldn't imagine a platform named SweatNet, but it's through Sandy Health God. They also have guided meditations. And Sandy and I'm going to fund some, hopefully some additional mindfulness classes through Sandy Health God's area. And so in those big tents, imagine being 6 feet apart and having like a noise counseling kind of headphone and going through a guided meditation kind of as a community. I know that doesn't meet everyone's needs. And so we're thinking about like when we can open the Lake campus again. Davidson Outdoors is doing local hikes and local bike trips. We've opened the climbing wall. The outdoor fitness center behind the Union is up and running already. And we're posting internally our numbers. And so a lot of students are going to that. We're open to having more food trucks on campus. I know the Black Student Coalition has already sponsored at least 1 food truck. BSC is going to offer some movie nights, I believe. The Union will do the same. And so ideally, between the food trucks and movie nights, students are getting a semblance of campus life or a student experience that Ren is talking about. And I know the Union Board is really excited about doing some other takeaway events too. And so if you have other ideas about that, please let me know, please let SGA know, please reach out to the Union Board, and we'll try to do everything that we reasonably can. Ren or Israel, did that answer the spirit of your question?
Yeah, that captured it pretty well. Thank you. Moving along, what efforts are being made to get non-athletes active on campus via activities such as clubs and sports, etc.? I know you mentioned that Davidson Outdoors is doing a couple of local hikes and stuff. Could you speak more about that, please?
Sure. And so if students go to Wildcat Sync, and we have guidelines for student organizations that want to do events. We also have, like we had a virtual, which I know is less than ideal, but a virtual activities fair. The eating houses and fraternities and sororities are doing we've greatly adapted what self-selection is going to look like. And so students can feel a sense of belonging in community by joining these organizations, but they won't be able to do all the same things, but they'll still feel a sense of affinity. So I was able to zoom in with Patterson Court organizations, and they talked openly about, look, these are the ways we're trying to actually form a sense of connection amongst our members. So I know that students are thinking about that. And I know sometimes students get frustrated when the administration says students are working on it, because they feel like you want to know what we're doing to make your life better too. But I'm really trying to empower students who have the best ideas. Like I would watch Black Panther every night of the week, and I'm sure many of you would too, but maybe there are other things you want to do to feel connected to each other. And so if we can work together, we'll come up with the money within reason to think about great ideas. A student said, why can't we have an ice rink on campus? I wish we had acted on that sooner, because I've been to towns where they actually have like an ice rink where students can be 6 feet apart and fall on their face or butt, but it's actually fun watching each other do it, right? And so if there's a groundswell of support for an idea like that, we will actually make it happen.
Yeah, I just want to second that. If we really want to try to follow student ideas here, so things that can be done in a tent, like once a student suggested to me, could there be a game night, or what can we do in the tent? And we will try to make it happen. But I kind of second what Dean McCrae says. What we would want to do is not what probably you would want to do. So it's best if the ideas come from students, and then we try to figure out how we can make them happen.
And Israel, I'd add in just in terms of clubs and club sports and intramurals. So intramurals kicked off last night, I believe, with Ultimate Frisbee. And so intramurals are rolling right now, which is great. Club sports, I feel, is following closely behind, should be starting off soon. And all of those have been put together. Sandy, Alan Sutton, Stephen Crespi have done a fantastic job working with Dr. Lutz, similar protocols and guidelines to make sure everybody stays safe and healthy. Mentioned the Lake Campus. We're targeting a return very, very soon that we'll hopefully announce if conditions allow it. And so I think from a wellness perspective and a recreation perspective, with Sandy's lead, the outdoor gym has been fantastic. I think, separate from athletics and scholar athletes, from a wellness and PE perspective, we're starting to ramp up to provide more of those opportunities, mostly outdoors, for students to engage in.
Okay, thank you. I feel like another big takeaway of that is that student feedback is important, and that you guys can send them emails whenever, and they'll respond within a reasonable amount of time. So definitely take advantage of that. Moving on to our third question. So will students get in trouble for breaking COVID policy if they report a Title IX complaint?
No. And so it's really important to me that students that have that concern are able to get access to support and resources. And so if a student experiences harassment or any kind of mistreatment, they should know. I want them to know that they can come forward, and we will support them without even if they have a strike, even though we don't use the term strike. And so please come forward to get support and resources and advice, and don't be afraid to come forward for that reason.
Okay, thank you so much. I'm going to hand it over to Ren now for the closing remarks. Thank you all.
Cool. Can I just add one thing just really quickly? And so I just want, so we had the outdoor gym last semester, and we now have a gym, a tent behind the union. And so I just want to make sure students understand we have 2 different venues by which students can actually be physically engaged or pursue their own kind of physical wellness. And so I just want to make sure that was really clear.
And I'll add on to that it's actually 3, because Baker actually lobby is open as well. You can reserve it online at specific hours. There's only 2 people allowed at a time, and there are lots of easy equipment there. So again, we're trying to bolster our capacity to provide opportunities for people to stay fit and engage in wellness activities. So.
Dean McCrae, just a clarifying question. So both of the outdoor gyms are open, the one by Baker and the one behind Union, correct?
Yes. Yep.
Okay. Thank you.
Great. Well, we have finished slightly early. So before I close this whole thing out, if there's anything else that you all want to communicate to the students, please go ahead and do so.
Ren, there were some quarantine logistics questions that it was one of those that I wanted to address if we had a minute, because I know this is something that's been in the news, and it says, what is the basis for the 14-day quarantine for close contacts if the CDC does not recommend quarantine this long? And so the CDC continues to recommend a 14-day quarantine. There are circumstances within which they say you can do a 10-day quarantine and test out of it. Unfortunately, the requirements of those circumstances are essentially you test out of it and you can't go to any crowds. You can't live in a congregate living situation. You shouldn't go to work. You should be masked and do all these things. So if you actually dig away at it, the reality is that where we live in a community living situation, we don't meet any of those requirements to, quote, test out of 10 days. And I have discussed this with the Mecklenburg County public health physician, just to ensure that I wasn't missing the interpretation. And Mecklenburg County says, yeah, no, we don't follow it. And so I know that's frustrating because quarantine's longer than isolation. That's a tough place to be for a lot of students. But at the end of the day, we've had students get sick those last 3 or 4 days of quarantine, and it's happened.
Yeah, I just want students to know that, I mean, we hear many of you that you want to know that we take this seriously, and we do. And I struggle sometimes with the, like, I feel like I've said the rules 17 times already, and some students aren't following them. And so I don't know that me saying them an 18th time is going to win. That's why I sometimes focus on the call in, so to speak. Students care most about what their peers think. And I think there's a form of positive peer pressure. And so I don't want any student to feel like we are dismissing their concerns or not taking them seriously. And so I would also want students to know that I've emailed all off-campus students twice now, once last semester, once this week, and that we really try to take everyone's sometimes competing ideas into consideration while we're doing our day-to-day work. And most of all, we promised you and we promised your families to create as safe an environment as possible. So sometimes our decisions aren't really popular, but they really are based in a non-paternalistic viewpoint on how to keep you safe and healthy. And we want you to have the college experience that we had and the college experience that you deserve. And so if we're falling short on that, please reach out to me, please reach out to my staff, and we'll do our best to improve it because we really want you to thrive and feel like you matter and belong here.
And just to, I mean, I would just emphasize Dean McCrae's ask, which is if you have ideas about things about activities or venues or other things that would, where, you know, please reach out. And I think that's where we get our best information, right? And we can try to create as many outdoor activities as we can. We can try to think about larger spaces that might be okay places to meet up. And we would much rather do that than repeat the rules 900 times. So let's focus on what is possible and you know, and the agency that we do have in this, you know, in this situation. And I think that's what we're all trying to do. And I know that's what you guys are trying to do too. And I'm really grateful for that.
Great. Before we conclude then, there are a couple of items left to address. First, we would really like to thank our panelists. This is, of course, not a convenient time, and we certainly have not asked easy questions. But in good faith, you all have shown up to directly face our student concerns. And we'd also like to express how incredibly grateful we are for the questions that everyone sent in for this Q&A. Again, we collected over 100 submissions. We can't address everyone's concerns, much less put everyone at ease right now. But we sincerely hope this session has at least like open lines of communication between the students and the administration. We've tried to authentically represent a lot of your questions and concerns, but just because of the length of the event, we've mainly stuck to those broad questions that pertain to really large numbers of students. So if your submissions weren't addressed, or if any other questions came up for you over the course of this event, there's a good chance you'll find answers in the FAQ section on Davidson's fall 2020 to spring 2021 webpage, which is in the chat below. And if you can't find your answer there, just please reach out to your RA or your hall counselor, your advisor, to SGA, or to the various dean's offices, and they will try to assist you. Our campus really depends on everyone lending a hand right now, and we hope this has helped out a lot. Thank you all very much, and have a good night.